Hello everyone, I'm Ian Givens. I'm a Professor of Nutrition at the University of Reading in the UK, and I'm also Director of the Institute for Food, Nutrition and Health in the university. And today I wanted to say just a few words to you about vitamin D, a really important nutrient. And this is a contribution, as you maybe know, to the BuzzGym's activities at the minute to make sure that the population remain healthy given the difficult situation that we're in at the minute. Now, of course, I'm sure everyone knows, and most people know, that we can produce vitamin D ourselves in our body. We can produce it in the skin when the skin is exposed to sunlight. Unfortunately, nowadays most people work indoors. Most people travel around in cars or in trains, and they're not exposed to sunlight even in the summer very much. And even in the summer, when we're out in the warmer sunlight, or when we're on holiday in a sunny climate, we tend to use sunscreens to reduce the risk of skin being burnt and of course the longer term risk of skin cancer and so forth. And of course these sunscreens are fantastically effective at doing their job. Unfortunately, they're also very effective at reducing the skin's ability to produce vitamin D. And one of the consequences of that situation is that we now have to pay much more attention to consuming vitamin D in our diet. We cannot rely simply on skin synthesis of vitamin D. The problem is, of course, that there are not many foods that are rich in vitamin D. There are two that always spring to mind, and these are the two which are the main source of vitamin D. One is eggs. The vitamin D is actually in the yolk of the egg, and also oily fish. And a lot of the oily fish consumed in the UK is salmon, and salmon is generally a good source of vitamin D. But of course, you would have to eat these foods regularly and in adequate amounts to provide you with enough vitamin D. And that's not easy. And that means we probably have to think about supplements. And of course, you can buy supplements in health food shops and chemists and nowadays. It's only also in the last few years, last 3 or 4 years actually, that in the UK we've had an official recommendation for how much vitamin D we should be consuming in the diet. And the recommendation is that everybody should be consuming 10 micrograms of vitamin D per day. And if you look at the fairly recent data from the National Diet Nutrition Survey, you see that as a population, on average, we are consuming only around about 2 micrograms per day. So you can see we're way off the 10 microgram target. And the other thing that's happened, of course, in the last sort of 5 to 10 years, I guess, is that the number of body systems that vitamin D seems to be important for has increased enormously. I mean, we've known for a long time that vitamin D is important in terms of calcium absorption and also the use of calcium, the absorbed calcium, in terms of bone development in children and also bone health in adults, of course, as well. So everybody's known that for a long time, and that's still true. It still is important for that. But it's also now known to be important in many other body systems. And indeed, there are almost certainly body systems that we don't know it's important in. And we'll probably find that out in research in years to come. One area that I just thought worth mentioning, given the current situation we're in, is that there is some evidence, it's not proven, but there is some evidence of a protective effect of an adequate vitamin D status in relation to respiratory disease. The evidence says that an adequate vitamin D status will reduce the risk of respiratory problems. But as I say, it's not absolutely proven, but it's beginning to show in that direction. And given the situation that we are in with this current virus, one of its features is the development of respiratory disease. It just seems to me to make sense that at least we ensure that we are of adequate vitamin D status. It will do no harm, and it certainly may do some good. So again, just thanks again to BuzzGyms for the opportunity for talking to you today about this. And please stay safe, follow the guidelines, and let's hope that the problem gets better fairly quickly. Thank you very much.